Assalamu alaikum. My name is Ikra Badr and my roll number is BP1650090. And the drug which is given to me is chlorhexinol. Indicated. Chlorhexinol is used for the purpose of disinfection and sanitization in different hospitals and households. It has also been found used in different antibacterial soaps, wound cleansing application, and antiseptics, creams and ointments, which is used for the purpose of disinfection and sanitization. Toxicity and adverse effect. When we talk about toxicity related to chlorhexinol, it is of moderate to low acute toxicity. It is divided into different categories which based on the degree of acute toxicity. Category number 1 shows the highest degree of acute toxicity which causes severe eye irritation. Category number 4 shows the lowest of 4 categories and causes slight skin irritation. Category number 2 and category number 3 are responsible for acute oral and dermal effect. Chlorhexinol is also responsible for redness, toughness, and cracking of skin at very high dose levels. Contraindication. Chlorhexinol is contraindicated in patients who are allergic to iodine or the patient who are under treatment with radioiodine. Chlorhexinol is also contraindicated in patients who are suffering from thyroid problems such as hyperthyroidism or other thyroid problems, as absorption of elemental iodine may occur. Dosage form and brand names. Dosage form can be soap and lotion, which can be applied topically and contain chlorhexinol. Brand names. Sunol. It is the product which is produced in Karachi chemical industry and it is of 132 rupees. The most common brand is Dettol, which is produced in Bricket and it is of 595 rupees. Dose adjustment. Chlorhexinol dose adjustment is not possible as it is not found in blood sample and cannot be detected easily in dermal administration up to 2 grams. We can adjust the doses so that we can find samples of chlorhexinol in the blood. When we give dose of 5 gram, only few traces were found. And when we increase the dose up to 8 gram, only 1 milligram percent was found in blood after 3 hours. After increasing the dose up to 20 gram, only 4 milligram was found till half an hour and 1 milligram percent was found up to 72 hours. Drug interaction. Abacavir and acetaminophen are those drugs when given with chlorhexinol may decrease the excretion rate of chlorhexinol and may cause high serum levels. Rational and irrational use and drug alternatives. Rational use of chlorhexinol is it is used for the purpose of disinfection and sanitization, hence found in antiseptic and disinfectant agent, which is used for skin disinfections and surgical instrument. It has also been found in different antimicrobial products, which is used to control bacteria, algae, and fungi. It is used in different emulsions, paints, wash tanks, and different wound cleansing application and antiseptic products. Irrational use. Chlorhexinol is very much effective against gram-positive bacteria as this chlorhexinol is responsible for the destruction of cell wall and it stops the function of enzyme. Drug alternative of chlorhexinol. It can be benzalkonium chloride and benzethonium chloride, which are the chemicals that are found in different antibacterial and antimicrobial agents. It has also been found in different medical products, including eye and nasal drops, soaps, mouthwashes, and cosmetics. Case study. A 52-year-old man was admitted to the intensive care unit following intubation for airway protection as a result of drowsiness and respiratory distress after he ingested 400 ml of Dettol. He developed hypotension. Electrocardiogram showed sinus tachycardia with a prolonged QTc of 650. He also developed acute kidney injury with normal anion gap metabolic acidosis. Blood and urine samples sent for formal toxicology analysis subsequently confirmed the presence of chlorhexinol and trypinol and isopropyl alcohol. How the condition of the patient will be adjusted. Soap notes. Subject. The patient was already suffering from drowsiness, respiratory distress, hypotension, sinus tachycardia, and acute kidney injury. Object. The patient shows electrocardiogram which shows sinus tachycardia with a prolonged QTC of 650, and the blood and urine sample were confirming the presence of chlorhexinole along with propioniol and isopropyl alcohol. Assessment. First of all, we need to control the QTC and serum bicarbonate level. And there is a need to adjust the renal injury that was happened after the ingestion of Dettol containing chlorhexinole and other products. Soap notes plan. We will control the QTC and serum bicarbonate level by returning them to the normal limits by giving the IV fluid and isotonic bicarbonate. There is no need of requirement for renal replacement therapy. His condition will be improved as the bicarbonate level will be improved. The patient should be extubated for 24 hours, which will decrease ulceration, and this ulceration was caused by Dettol containing chlorhexinole, and as the person will be extubated, this ulceration will ultimately be okay. References. Thank you.